Welcome to the Daily Brief on Metro Milwaukee's health and the economy, brought to you by the Medical College of Wisconsin and the Metropolitan Milwaukee Association of Commerce. I'm Tim Sheehy, president of the MMAC, and I'm joined by my co-host, Dr. John Raymond, president of the Medical College. Each day at 3:30, we deliver a 19-minute fact-filled update on the health and economic impacts of COVID-19. This webcast is powered by Aurora WDC, and there are handouts available if you click on the panel. We're also joined today by Peggy Williams-Smith, the CEO of Visit Milwaukee, responsible for marketing and selling the region to tourists, visitors, and convention goers. And we'll get an update from Peggy on the industry and how it's meeting these challenging demands. But let's start with our health update from Dr. Raymond.
Thanks, Tim, and good afternoon, everyone. As you know, over the last 3 weeks, we've been tracking the progress that we've made to stop the spread of COVID-19. And we've been following two indicators. The daily growth rate measures the percentage of new cases every day, and a lower number is better. The doubling time is the predicted time it would take to double the number of COVID-19 positive cases in our state or our region. In that case, a higher number is better. And we've seen steady improvement in both of those measures and some stabilization today. As of today, there were 75 new COVID-19 positive tests in Milwaukee and 166 in Wisconsin. The daily growth rates are slightly improved to 7.8% in Milwaukee and 8.2% in Wisconsin. Recall that 3 weeks ago, the growth rate was nearly 35%. So this shows stabilization. The doubling rates originally were lower than 3 days when we started to measure them 3 weeks ago, and those have slightly improved or stabilized today at about 8.8 days in Milwaukee and 8.5 days in Wisconsin. If I could have the next slide, please. This slide shows key indicators of hospital capacity, which we shared with you yesterday, and the capacities are similar to those that we showed you yesterday. The first 3 rows show that we have adequate capacity of hospital beds, ICU beds, and ventilators in our region. But we still have a significant number of hospitals with an insufficient supply of personal protective equipment, as shown in the last row. And I believe that this is a problem that will be with us for quite some time, even with the responsible reuse of N95 masks and switching from disposable to washable gowns. Next slide, please. This slide shows 5 of our health and safety indicators, which I believe are must-haves for a smart restart of our economy. These are similar to guidelines and goals announced this week by the World Health Organization and by California Governor Gavin Newsom. We've upgraded 2 of the indicators to yellow. The 2 yellow indicators are sustained case reductions and hospital capacity, denoted in the left-hand column as cases and care. But we're in the red for the other 3 indicators, and it's clear that we have a lot of work ahead of us, but at least we have a rational framework to use as we go forward. Now I'd like to switch topics briefly and address some questions about predictive modeling that have come in during previous briefings. Next slide, please. So what is predictive modeling? Predictive modeling is a subset of concurrent analytics which use 2 or more types of statistical analyses simultaneously. And the goal of predictive modeling is to anticipate an event, behavior, or outcomes. In other words, to make a prediction. Predictive modeling is frequently used in finance, healthcare, and in other sectors of the economy, so the principle or the concept is not a new one. In simple terms, predictive models use historical data sets to make predictions about the future. But predictive models are only as good as the assumptions that go into the modeling, and I think we've seen that with COVID-19. Next slide, please. So why have predictive models of the COVID-19 pandemic been so notoriously inaccurate? First and foremost, we lack historical data about COVID-19. Recall that we only have about 100 days of history with this new virus. This means that the modelers have made inaccurate assumptions about virus characteristics and virus behavior. And those inaccurate assumptions also apply to the impact of government and individual social distancing interventions. This problem has been exacerbated by some initial challenges obtaining accurate data about hospital beds, ICU beds, and ventilators. Now, in order for a model's prediction to be trustworthy, the model must accurately reflect how the infection progresses in real life. And to do this, modelers typically use data from prior outbreaks of the same infection, both to create the model and to make sure that the predictions match with what people already know to be true. For COVID-19, the modelers were forced to make assumptions based on the Diamond Princess cruise ship and early inaccurate reports from China, or to draw conclusions from questionable associations with what happened with SARS, MERS, or influenza. Next slide, please. This slide is simply for your reference and for future information, showing the four most popular models from the University of Washington, University of Pennsylvania from the Creative Commons, and COVID Act Now. Next slide, please. Now that we've begun to flatten the curve in Wisconsin and in other parts of the country, many have asked whether we can predict the impact of relaxing social distancing. The simple answer is yes, but probably not all that accurately. We lack the historical context and the information that we need to guide assumptions. Now, the complexities of modeling are highlighted in an excellent article from Biomath, the reference of which is provided there for you if you wish to look at it. I will assure you that the MCW Institute for Health and Equity is also developing a model that might be useful to guide us as we endeavor to have our phased reopening and smart start of the economy. So I'd like to end by thanking all of you for your diligence and your support of social distancing. You have saved lives. Thank you very much, and I'll turn it back over to Tim.
Thanks, Dr. Raymond. Before we bring Peggy Williams-Smith back on, just a quick question for you out of the news today that the FDA was releasing, I think, 20 million tablets of hydroxychloroquine. And the question I've gotten is, are any of those tablets coming to Milwaukee? And what do you think about the tablet?
I'm not sure that any are coming to Milwaukee, and I'm also not sure that we really want or need them. I think that the evidence suggesting that hydroxychloroquine or chloroquine are effective still remains scant. And there are increasingly troubling reports of side effects, including cardiac deaths, that are known side effects of those drugs. So this is something, again, that remains a decision between the patient and their doctor.
Great, thank you very much. So we're going to pivot here and talk to Peggy a little bit about her relatively new job. And probably the understatement of the day to say this has been a tough start, but you're the right person for it. We're lucky to have you in the position you're in. So Peggy, can you give us a little update about the impact that COVID has had on the hospitality industry and how you're starting to deal with it?
Absolutely. Thanks for having me, Tim. And I am extremely excited to be in the position, even though it has been quite a change from when I took over. So I wanted to start with a few statistics for you. So if we could go to the next slide, please, the next two slides. Star recently came out with how they are saying that the year is going to end for the hospitality, the hotel industry. And what they're saying is that demand will be down year over year from 2019 by 51%. Occupancy down 42% to 37.9. To put that in context, the lowest recorded occupancy statistic since they started measuring in 1987 was right after the 2008 recession in 2009, and that was 54%. They're saying the ADR will end the year at 112.91 and RevPAR will end at 42.84, which is 50.6%. Oxford Economics said that spending last week was $3.3 billion in travel spending, which was down $19.9 billion from the first week of March. And for the week of April 4th, the nation suffered an $18.6 billion loss in travel year over year. And Wisconsin saw a loss of $631 million in travel spending from March 9th through April 4th. The recent STAR for Milwaukee, March's STAR hasn't come out yet, but the 28-day rolling report says that occupancy in Milwaukee was at 23.3%, which was a 68% decline year over year. Our revenue for the rolling 28 was $3.8 million compared to $14 million last year, which is a 73% decline. Specifically for conventions for the city, as of April 12th, we had 34 events that were booked the Visit Milwaukee sales team and scheduled to take place at the Wisconsin Center and or our partner hotels throughout the city that have canceled. There's an additional 16 events that have postponed and are looking for dates. These events represent a combined estimated loss and economic impact of over $47 million and an estimated loss of over 61,000 room nights. And if you took that times an average rate of what we ran last year, that's $7 million in hard spending alone for the Milwaukee area hotels. And we've also seen that 16 area hotels have temporarily suspended their operations. But it's not all bad news because travel is in our DNA. We receive a weekly report from Longwoods International, a study of 1,000 people, and 70% of travelers are still planning trips in the next 6 months, and that's up from 65% last week. They will be changing their travel plans, switching from international trips to domestic and from air travel to car travel. And we do know that consumers continue to be interested in future travel as demonstrated by their interaction with content, and we're trying to react to that content on our website. So some of the resources that we've put forth, you can go to the next slide. At visitmilwaukee.org/coronavirus, we have a link to the impact that it has caused directly in our region. We've also got frequently asked questions about the coronavirus. We have our Good Things Are Brewing page and how you can get involved. If you go to the next slide, Good Things Are Brewing, this is where we talk about things like addressing food insecurity, how we've come together as a community, and it's amazing how we've come together as a community, helping those in need and making lives easier. We're also started a page with special hotel rates on the next slide, where first responders and essential personnel can book rooms within our hotels at special rates. We also partnered with Aurora and Versity to do a Hospitality Heroes blood drive, the first of which took place yesterday at the Cooperage, and they had an amazing turnout, better than they anticipated. And the next two, one will be tonight at Adventure Rock, and one on April 16th at Saz's South 2nd. And we are looking for other hospitality partners, hopefully to put on a few more of those. As we look forward, this was the year of Milwaukee. If anyone received an email from me over the last 4 months since I started this job, our signature said it was the year of Milwaukee with everything that was slated to happen. Thankfully, some of those events have postponed and are still looking to happen. So if things as they are currently scheduled, State Fair is still slated to happen. I spoke with Kathleen O'Leary this morning. We still have Irish Fest, Mexican Fiesta, and Summerfest, which can help us to promote what we think will come back first, which is leisure travel. Then we have some pretty large conventions which are still slated to happen in the starting in August with Microscopy, Northwestern Mutual, the Democratic National Convention, and Ryder Cup. And of course, Milwaukee is always beautiful in the fall. And we are within a 6-hour drive of a large portion of our population. So we are now calling, and not just us, but other travel industry experts, 2020 is the year of the car, and regional travel will come back first. So that's what we'll be focusing on as we move forward. People will be looking for transformational travel, traveling for weddings, family gatherings, anything where they can have people connections. And business travel will also come back, not conventions, but individual travel for working customers. And one thing I wanted to bring up to the people on this call is we are going to actively be working on a Bring It Home campaign. At this time, Milwaukee needs you, our local business leaders, to host your meetings and conventions here. Your business is based here, your employees live here, and they're raising their families here. When you host your meetings here in Milwaukee, you're going to bring visitors and revenue into the city. And now more than ever will be the time to showcase Milwaukee as a business destination.
Thank you, Peggy. That was a tough but hopeful update.
Yes.
One question, and I'm going to bring Dr. Raymond back in so you can both answer questions from our viewers. But one question for you is, even in these challenging times, it looks like the expansion of the convention center is still moving forward. What's your view of that?
My view is, thank goodness it's about time. It can't come soon enough. It will put us at a level playing field with our peer cities when competing for convention business. It's something that is definitely needed.
And then how regular of an update do you get, Peggy, on the DNC and how it's progressing and how it's going to make its decisions?
Well, I have a daily call. Up until yesterday, it was twice a day with the DNCC talking about housing and working with our hotel partners to make sure that we have the correct rooms in the correct places for the convention. So we are moving full steam ahead as though our delegates will start arriving the week of August 17th and spend 4 days here. It'll look a little different than we originally anticipated, a little smaller, and it will all depend on where we are in the social distancing in the world. But, you know, as of right now, we are slated to host the Democratic National Convention.
Great, thank you. Chris, we have questions?
Yeah, we had a first question would actually be suitable for both of our guests, and it involves looking into that crystal ball a little bit. How will this outbreak change the way we view big events and gatherings, and will we ever be quote unquote normal again?
Well, from a meeting standpoint, anyone who's been on Zoom, GoTo, Aurora webinars for the last 4 weeks, the need for personal interaction and to be able to have conversations in person and read someone's body language over more than just a camera will be needed more now than ever. I see us, when it's safe to, obviously safety comes first, and I think we look to Dr. Raymond for that answer, but we will meet again and we will meet in person.
Yeah, I agree with Peggy. The large gatherings really are going to depend on whether we have an effective vaccine or that we can extinguish this virus one way or another, and then have people have their confidence restored that it's okay to gather in large groups.
Peggy, a question for you. What are you doing to kind of keep the morale among your team and everybody in the community?
Well, I'm an eternally glass half full type of person, and I've tried to kind of stop my blind optimism, but I do think it's important to have conversations. I send out communication no less than probably 5 times a week to our partners, our hotels, our hotel and hospitality community, which has been affected so very much by what's been going on. And then with my team, I meet twice a day via video conference call so we can see each other. We can talk about what happened overnight, what new happened in the world, and then what happened during that course of that day.
Very good. Dr. Raymond, we had a question about whether we are at or past our peak, and how would we be able to tell that?
I don't think we're past our peak. Of course, I tend to be conservative. We're hopeful that we're at a sustained peak and that soon we'll start to have a decline in the number of cases. But there's so much variability in the day-to-day numbers that we have both in Milwaukee and across the state that it's hard to say that there's much of a trend other than that it looks pretty flat for the last week or so, and that's good.
If you look at the number of deaths, which I believe is up 14 from yesterday, does that indicate sort of a spike, or does that lag behind the hospitalization numbers?
Deaths usually lag behind the peak of resource use and the number of new cases in other communities. But, you know, compared to other communities, we have a relatively small number of COVID-19 positive patients. So it's hard to draw any strong conclusions. I'm hoping that our deaths will peak. You know, we talked about predictive modeling. The IHME model predicted that the peak in deaths would be late this week.
Another question for both of you. Can you envision a time, perhaps this fall, where you may attend a public event, but you do it while wearing a face covering?
Maybe. I think we're going to be wearing face coverings out in public for quite a long time, again, until we have an effective vaccine or we manage to extinguish the virus.
I defer to Dr. Raymond. It looks like I'll be wearing a face mask this fall.
Dr. Raymond, how will pent-up demand for elective surgeries eventually play out, do you think?
I think there is pent-up demand, but I don't think that our sector is going to rebound, even if we have capacity to give elective surgeries. People are going to be concerned about discretionary spending. There may be people that don't have health insurance going forward, and I think that's going to be a challenge for the health systems as we go forward. There's very unlikely to be a quick rebound of volume or of cash flow.
Great. Thank you to you both, and thank you to everybody who asked a question today.
Well, again, Dr. Raymond, thank you for your precise information on where we stand in our healthcare world. And Peggy, thank you very much for your leadership. And you can take some solace, I think, in FDR's comment that smooth seas don't make a skilled sailor. So you'll be well skilled here when we get through the year. So again, thank you all for joining us. Tomorrow we'll be joined again by Dr. Raymond and Paul Farrow, the Waukesha County Executive, to give us his perspective. And then we'll wrap up with trends for the week on Friday with Dr. Raymond and Mayor Tom Barrett. Again, have a safe afternoon and thank you for joining us.
Thanks, Tim. Thanks, Becky.
Thank you.